Hello everyone, I am Dr. Mary Goforth. I'm one of the pelvic health specialists at Cornerstone Physical Therapy. I work at our Woodfin location. Today I'm going to talk quickly about bladder irritants. So this is important, especially for those of you who might be experiencing or have experienced, or just to know, in case you experience this in the future, urge incontinence or urinary urgency or frequency where you just feel kind of irritated, like you need to pee all the time, or you actually lose urine, especially when you just get the urge to go, which is not normal with that initial urge. It's never normal to leak urine, but especially not when you just get that initial signal that you need to pee. So most common bladder irritants that I go over with my patients: caffeine. So coffee, tea, soda, whatever form of caffeine it is, caffeine is a very common bladder irritant. The next C, so to say, is carbonation. So even seltzer water is a bladder irritant. A lot of my patients don't like me when I tell them this, especially if that's their main source of water intake is seltzer water. And then the other big one is alcohol. You probably noticed this if you have a glass of wine, especially if you're dehydrated. It doesn't take long before you need to go pee and use the bathroom. And you know, if it only happens around that time of having a glass of wine or something else, it's not as big of a deal. But if it's happening every day and you're potentially using urine, that is a problem. So those are the big ones. I've got my list here. This is a handout I give to my patients when we realize they are maybe having too many bladder irritants or they're not sure, and so it's something I send home with them so they can check in on themselves. So the other big things that are often irritants for the bladder in most people, we talked about caffeine, alcohol, carbonated drinks. Some other ones that you might not think about right offhand: medications. Some medications have caffeine in them, so therefore that counts as well. Chocolate, especially dark chocolate, has other good health benefits, but just know that if you have an excessive amount, that is actually a bladder irritant. And then smoking, so also not great for the bladder. So those are the ones that are irritants in most people. In the middle category, where there are certain things that irritate some people, just to hit a few highlights: in general, acidic foods like different fruits, really spicy things in meals or peppers can be irritating to some people. Tomato-based products, artificial sweetener, something again you might not think about, and this is not irritating in everybody, but some people. Sugar, honey, corn syrup, milk, and milk products. So those are in that middle category of not irritating to most people, but some people. And then the last category, I just like to give people ideas of, especially fruit, that are not irritating, because okay, well, if citrusy things are irritating to the bladder, I thought I was supposed to eat fruits, you know, that gives me my fiber intake. It is good to eat fruit, of course, but if you're struggling with some bladder irritation and you want to calm it down, first, some fruits that will likely not aggravate your bladder: apricots, papaya, watermelon, prunes, pears. And I just like to throw out a few examples to people just to give them options so that you can still think about getting your fiber intake in, but to calm the bladder down if it is in an irritated state. And the other big thing I like to just say, kind of bartering with people, because although yes, your doctor might tell you, okay, you're having all this urgency, you need to just totally get rid of those irritants. That is the best option, absolutely. But a lot of us find that very challenging, and we're likely to just not do it at all, versus if we can kind of meet a middle ground, we can start working towards not having those irritants at all, potentially, or in a very small amount. For example, coffee. A lot of us drink coffee first thing in the morning. So I kind of barter with my patients, and if they tell me, you know, I have 4 cups of coffee every morning, I'm not going to stop drinking coffee no matter what you tell me, I'll say, okay, well, could we drop it to 3 for the first week or 2, and then so on, get it down to something reasonable like 1 or 2 cups of coffee in the morning, and then do what I call the water sandwich, where before you have your first cup of coffee in the morning, you drink a cup of water, you enjoy your coffee, and then you immediately start drinking plain water right after. So you're diluting that bladder irritant so that by the time it gets to your bladder, it's less likely to be irritating. So hopefully that helps. Again, if you guys have questions, please put them in the comments below, and I'll see you guys next time.